This is Dr. Shwetha. I'm from Janista Fertility Center and Hospital from Bangalore. Now, what are the effects of alcohol on fertility? So we can divide it into what are the effects of alcohol on female and what are the effects of alcohol on males, as well as what happens when a woman consumes alcohol during pregnancy. So what happens when when a woman is trying for pregnancy, alcohol consumption is forbidden. Why? This is because whenever they consume alcohol, it disturbs ovulation, and also whenever there is disruption of ovulation, your period starts getting spaced out and you'll have irregularities in the period, thereby decreasing the fertility rates in a natural pregnancy. What happens? What are the effects of alcohol on IVF pregnancy? What happens is there is DNA damage when a woman consumes alcohol. When they consume more than 7 shots of alcohol, there will be a decrease in pregnancy rate even with IVF. So, similarly, what are the effects? What we see in men? When men consume alcohol too, there is DNA damage in the sperm. In turn, having difficulty in fertilization, there will be difficulty in motility, the sperm motility, and the normal forms. So when everything affects overall in the semen analysis, therefore, the pregnancy rate drops down again for men when they're trying for a normal pregnancy. Apart from this, whenever there is an excessive alcohol consumption, definitely there will be erectile dysfunctions and also difficulty during intercourse. So definitely when people are trying for pregnancy, either it is a natural pregnancy or an IUI pregnancy or an IVF pregnancy, definitely alcohol should be avoided. Now what happens during pregnancy? A woman who is pregnant and consumes alcohol, so there will be increased chances of miscarriages and sometimes there will be certain abnormalities also in the baby. So overall, no to alcohol when they're trying for pregnancy or during pregnancy. Now, what are the effects of smoking on fertility and as well as reproductive outcome, that is pregnancy? Now, when it comes to smoking and fertility, it's divided into 2 categories. What are the effects of smoking in men and what are the effects of smoking in women? Whenever women are trying or is trying to conceive, what happens when they smoke is it causes DNA damage in the oocyte. So whenever there is DNA damage in the oocyte, there will be decreased fertilization rates, be it in a natural pregnancy or an IVF pregnancy. This is the effect on the quality. Now what happens to the number? So with increase in smoking, the rate of depletion of eggs is rapid in women who smoke. So thereby decreasing the AMH levels considerably, and also whenever there is a lot of smoking, the blood supply to the ovaries get hampered. When this gets hampered, and even the uterine blood supply also gets hampered. So indirectly, you get decreased number of eggs as well as decreased implantations whenever the blood supply to the ovaries and uterus is cut off due to smoking. What happens when men smoke? Smoking in men is very, very, very common than what the percentage of women who smoke. What happens when men smoke? The effect is seen both in the quality as well as quantity. So what I mean by quality defect is the smoking damages the DNA. DNA is important for normal fertilization to happen. What happens when the DNA fragmentation is more during IVF? The effects of it is very, very, very severe. What happens is the fertilization rates drop down, increased chances of miscarriages happen in the pregnancy. What happens to that's about the quality. What happens to the quantity? So there will be decreased sperm count, decreased motility, as well as normal forms also will be decreased. So overall, whenever there is effect on the quality and the quantity, definitely the fertility rates drops down drastically in men. What are the effects of smoking on pregnancy? Smoking in pregnancy, during pregnancy, has a huge impact. Basically, what happens is smoking induces collagen damage. So, along with the collagen damage, there will be a decrease blood supply to the uterus, and in turn, the blood supply to the baby also will be reduced. What are the effects of this? So, basically, it means there will be increase in miscarriage rates, preterm delivery rates, sometimes early rupture of membranes happen. So definitely whenever people are trying for pregnancy, no smoking, no alcohol, both in men and women.